Plastic surgery is a visual field, and the mainstay is before and after pictures, and that's what we use as our marketing tools and what we can deliver as artists. But now with the advent of filters, some of these can be misleading, and so I'm here joined by two of my colleagues today, Dr. Hughes and Dr. Cook, to talk about how these photos can be warped or manipulated and can be a little bit misleading when we talk to our patients. What do you guys think?
Well, I think misleading is a kind word, actually, and we see it just exploded. It used to be years ago, if you wanted to do a deceptive thing, you had to hire an airbrusher and this and that. Now everybody has access to these tools, and it's so obvious. You really see it particularly in a lot of the commercial applications, the laser companies and so forth. You're the magic of this laser. And one is shot, the before is shot with a light coming from the side, so you see every little wrinkle. And the after is shot with the light coming from the front. And voila, you have perfect skin.
Yeah, and I think, again, misleading is a kind word. I've actually got a sense recently that patients are becoming really skeptical about before and afters, and even saying, is this real? I don't really believe this. Particularly with industry photographs, right? They're going to pick their best ones, and
Sure.
Some of them might even be airbrushed. So when patients look at my before and afters, they ask, are these your patients, first of all, or is this sort of a stock photo? Because they're very skeptical of it.
Oh, I think it's great. I think it's making people skeptical, and I think that's actually a very healthy thing.
I agree.
I think if we get back to honest and open communication, and some of what's gone on social media, in my opinion, has really denigrated our field. I call them the dancing dogs. They'll dance for anything as long as they get some sort of a reward. And I don't mean to insult dogs, but I find it really a sad phenomenon because it drags down all the good people in
Sure.
our field. It really does.
So because of that, I like to use my before and afters in a slightly different way. With a patient, for reputable surgeons like us, it's not about getting a good result or a bad result, right? My approach is, let's give you a result that is what you're looking for. So say breast augmentations, for example. For them to look at it, it's not good or bad. Of course I'm going to put my good results on, airbrushed or not, but it's more which of these fits your personality. So I use it sort of as a talking tool rather than saying, look how good of a surgeon I am. I can
Right.
create these perfect breasts.
Absolutely. Then it's a communication tool, and that's
exactly.
what it really should be all about.
Do you think it's setting up unrealistic expectations when you talk about the airbrush and the curves? I mean, some of these things are just not obtainable
Absolutely.
in not only certain gals' body types, but globally in general. Do you think that that's making those conversations harder?
I think there's a real potential for it. I'm blessed because I've been at this for a while, and I have most of
You've
my
got a whole
practice
gallery,
is
yeah.
repeat patients. I know them, they trust me. But I think yes, for some of the new patients who come in the door, you really have to disabuse them of some crazy concepts.
And I actually like it because it allows me to be pretty blunt and straightforward with them,
Right.
saying, this is not real. I appreciate you want to look like this, and we'll try to get as close to you can as possible. That's not real. So it allows us to be honest with them, whereas before I think we might have skirted that topic a little bit, but
Sure.
things have gone so far with the filters and the airbrushing that it's almost comical.
It's laughable. Yeah, exactly. Yeah, I get it. All right. Yeah, I agree.
It's a show.
Yep.
Yeah.
For more topics like this and others, go to theplasticsurgerychannel.com.